Artificial Intelligence Doctor, www.abcpharma.net/English. Video showing an ECG after 2 months of an Aveir VR leadless pacemaker implantation. 2 months after an Aveir VR leadless pacemaker implantation, an ECG would typically show paced rhythm. The primary finding would be evidence of ventricular pacing, with the pacemaker spikes preceding each QRS complex. The morphology of the QRS complex might be slightly different than the patient's intrinsic QRS, reflecting right ventricular pacing. Underlying rhythm depending on the indication for the pacemaker. The underlying rhythm may be sinus rhythm, atrial fibrillation, or other bradyarrhythmias. No evidence of lead-related complications as the Aveir VR is leadless. There wouldn't be any ECG signs related to lead dysfunction or dislodgement. Stable QRS duration and morphology in patients with pre-existing left bundle branch block, LBBB. The QRS duration and morphology may remain unchanged or show some improvement due to the pacemaker's more physiological pacing location. No significant STD wave changes. Generally, no new STD wave changes should be observed unless there are other underlying cardiac conditions. It's important to note that the specific ECG findings might vary depending on the patient's underlying heart condition and the reason for pacemaker implantation. The ECG should be interpreted in conjunction with the patient's clinical presentation and other diagnostic tests, if necessary. Any new or unexpected ECG findings should be investigated to rule out potential complications or changes in the patient's cardiac condition. In conclusion, an ECG 2 months after an Aveir VR leadless pacemaker implantation will primarily show evidence of ventricular pacing with the absence of lead-related complications. The underlying rhythm and QRS morphology might vary depending on the patient's specific condition. Overall, the ECG should be stable with no significant new changes unless there are other underlying cardiac issues.